Hello everyone, good evening. There is something we see every day and yet unsee. It's called gender disparity and it's all around us. But it begins at home. The average Indian woman spends 352 minutes in a day doing domestic work. The average Indian man does 52. In her workplace, the average Indian woman earns 34% less than her male counterpart for doing the same job. We see this every day. But what we don't see every day is just how low a priority a woman's health is to her family and to the society she nurtures. Do you know that 80% of organ donors in our country are women? I'm going to repeat that. 80% of living organ donors in our country are women. And 80% recipients are men. Essentially, 4 out of 5 living donors in India are women and 4 out of 5 recipients are men. And these women are mainly wives and mothers. And if these wives and mothers need an organ, chances are their husbands and sons aren't willing to part with their organs. Why? In a nutshell, patriarchy. A man is the breadwinner. His health is priority. The woman on whose unpaid labor we build our economy is simply not priority. I want to understand this data that we are putting out for you from our experts who are joining us this evening. Steffi Devar is a senior correspondent of the Times of India. She's the first person to write this story. She has deep perspective on women's health as well. Dr. Vasanthi Ramesh is founder director of NOTO. Thank you very much. And Dr. Sudhir Kumar is a neurologist at the Apollo Hospital in Hyderabad. Dr. Vasanthi, I want to come to you and ask you, why and what is it that you've seen in your experience?
Good evening, Shreya. Thank you for having me on this important, thing about organ donation and transplantation. And in fact, this has been an area very close to my heart. And also, we won an award in the TTS 2020 for a paper which we had written on gender disparity, a mentor-mentee award. It's most important because it is a worldwide phenomenon, and it is more so in a country like ours, where women take on the role of the caregiver, and in addition, men being the breadwinners, they feel that if the men are allowed to subject themselves to donating organs, the family will suffer. Little is it realized that because the female holds fort, the men are able to work. So attention has to be drawn to eliminate this gender disparity, and this should not only be among the public, but also among the professionals. This should be both with the male as well as the female professionals being sensitive to the issue and ensuring that this gender disparity is mitigated.
Dr. Vasanthi, could you anecdotally tell us if
Gujarat
women are often pressurized by their families to actually donate organs? They may not want to, but are pressurized. They don't have a choice by the end of it.
Yes. The latest, one of the recent anecdotes which I would like to say is a lady who was married, developed kidney failure and was in need of an organ. Neither her husband or anyone in her family among the in-laws side were willing to donate. The mother was really pressurized to donate, and she was even worked up to be a donor for a kidney transplant. And then it turned out when she came to me that she had a lump in her breast, which on investigations, we confirmed that it was a breast cancer. And then we told her that, within the presence of a malignancy, she cannot donate an organ, and therefore it had to be stalled. There are also cases which I've heard from my colleagues where the donor, being a lady, is brought into the operation theatre, and then, you know, the surgeons have to create some excuse so that when they realize she's been forced to being a donor, she's not taken up for surgery.
So, Dr. Sudhir Kumar, what do I understand of it? Is this how I understand this story? That if a male member in my family needs an organ, the women are expected to donate. In fact, in many cases, are pressurized to donate. But if the situation flips, the son or the father will not be willing to donate an organ. Is that how I understand it? Because I believe that most women in India who require organ donation end up in the waiting list.
Yeah, I think it's a very, very important topic, and this is not something new. It has been seen for the last 2 or 3 decades. And you're absolutely right, because and all the data also shows us that 80% of donors are women. So when a man needs an organ, it is understood in this male-dominated society that it would be either the wife or the sister, or even in some cases mothers who will donate, and only 20% of donors are men. And for this, there are a lot of misconceptions among the public. One thing is that they feel that organ donation is a surgical procedure, so there could be a health risk to the male or the men, and who are the breadwinners. But the risk is very minimal, and the risk, it does not differ between men and women. So that that is not correct. And so it boils down to that, in our society or in our country, women's health is not a priority. So we are talking about organ donation today. But when I look at my last 30 years of clinical experience as a doctor, what I see is that even for the outpatient visits, women are not brought forward until they are late. So when the symptoms are minor or mild, very often they don't come to hospital, or they are not allowed to come to hospital. Only when they get serious complications, they come to the hospital. Another thing I have noted is that when wives have a sickness, husbands may or may not accompany them, so they come on their own or with some friends. But if the husband is ill, always wives accompany them. They leave everything. They also are working nowadays. So it is always the men's health which gets a priority. Coming to the organ donation, I have seen some cases where the liver failure has happened because of alcohol abuse, and they the husbands get drunk, and even they beat their own wives, and even the same wives in the end they are giving the organs or their own part of the liver for the liver transplantation. Despite that, the men, they remain well for, they don't touch alcohol for 1 or 2 years. Again they start go back to alcohol, and then again start doing the same thing, beating their own wives. So this is almost like a thankless job. So first of all, the wives are donating the organs, and despite that, the men are not changing their bad habits. So it is absolutely not correct. So all along the way, the women's health is not a priority, and that is the thing what we routinely in our OPD, even in patients. If somebody needs a very expensive treatment, let's say something that costs a lot, so there are chances that if it's a woman, the family may not come forward to foot the bill, and they'll say, okay, fine, doctor, can we look for something less expensive? Whereas if it's a male member, the same family is willing to spend and get the treatment done.
Steffi Thevar, I read your report, in fact, in the Times of India, and then picked the topic up for urban debate. I want to ask you, there is this one set of data that simply jumps out at us, that 80% living, organ donors in India are women, and 80% recipients are men, and that tells us a story. But that's not the only data that should be jumping out on us. There are other things as well.
Like Dr. Kumar rightly said, that today we are talking about organ donation, but women's health is always the last priority in the family. Recently, when we saw COVID vaccines being distributed, even in that case, we saw that women always send the men to go ahead and get themselves vaccinated first. Either the women just ignore their own health, or they are made to do so, and men just prioritize their health. And like Dr. Kumar said, when the symptoms are just worsened, the women will come forward, and then there is no option left. and then they're brought to the hospital in a very critical condition. With respect to organ donation, yes, the situation is very critical in India. The data that I have analyzed is past 10, 20 years of data. And I don't see it likely changing in the coming years. There needs to be a societal change for us to think that there can be a better situation. Women are forced to donate their organs. If we talk to the coordinators at the hospital at the ground level who are directly counseling the families, they say that the women, up until the point they come to the surgery table, they are just not willing to do it. Either they are forced to be caregivers or altruistic, and they just have to accept their fate. But when the woman needs it, the men would just deny it. They think that they have the right to deny, but the woman, if she thinks of denying it, she's just name shamed, and she just does not have that option. We have seen this when we talk to doctors and to workers on ground. They say the same story. There are doctors, in fact, when I spoke to them, the situation is so worse that in government hospitals, men are not willing to even donate blood to their wives. That is the level of patriarchy that we are talking about.
So can I just broaden this conversation, Dr. Vasanthi, and ask you, correct me if I'm wrong, but one person is added every 10 minutes to the queue when it comes to organ donation. Why do people in our country don't donate enough? Because, and please help us bust some myths around organ donation so that people who are watching today, can take the right decisions, the mindful decisions and decisions that are actually good for our country.
Steffi, it's very important that, channels like yours, both the print media and the electronic media, really bring about an awareness of the appropriate kind among the public. Because in Croatia, it is the media which had made a huge difference in terms of organ donation. So I think this program of yours would go a very long way in achieving that objective, or at least in initiating that plan. The WHO has said that the ethics of organ donation and transplantation is very important. Social justice and equity is a priority. In fact, it goes to the extent of saying, if you can be a donor, why can't you be a recipient? This is for the women. And if you can be a recipient, why shouldn't you be a donor? This is for the men. I would not, paint everything with the same brush, because now with increasing education, there are several families where men have opted to be donors. I can quote an example from my own family. My cousin brother, who's a dramatist, a very famous one at that. If you're familiar with the Tamil Nadu scene, you may have heard of Mr. Crazy Mohan. So his wife developed kidney transplant when they were, having their shows in the US. And then when they came back, they decided to have a kidney transplant. Her father opted to be a donor, but he was not compatible. Her brother opted, he was also not compatible. Then Crazy Mohan's brother, my cousin brother, Madhu Balaji, he became the donor. And she did extremely well for 20-25 years. But unfortunately, we lost her due to COVID recently. So there are instances where men have come forward. And I think this example should be carried forward. Get wide publicity and carried forward, so that more men would have the courage to come up.
Okay.
Because, with all that, he has been traveling around the world and doing everything. So their work will not be affected. So neither the wives should be afraid that their husbands will not be able to fend the family or bring an income home. It's very much possible. They're as normal as anybody else.
Okay.
And in fact, there's an article from Switzerland which says that kidney donors have greater longevity because they are on regular follow-up.
Okay. I quickly want to speak to you, Steffi, about cadaver donors. Fact is that it seems that when it comes to cadaver donors, men are the ones who take a lead. The families, in most cases, decide that their organs can be donated. What's the logic behind that? Help me understand
Right.
that.
Right. When it comes to cadaver donations, most of the donors are accident victims. So when a person is declared brain dead, the family is asked to give consent, even though if the person has willingly signed up for donation, until and unless the family agrees to donate, the organs cannot be retrieved and transplanted into another person. So, since most of the cadaver donations are through road accident victims, there are more men who come forward and their organs are retrieved and the organs are transplanted. But like Dr. Vasanthi said, that there needs to be more awareness among the public as well as professionals. They need to look at other pools of potential donors. I was talking to doctors who said that often cobra snake bite victims are overlooked. They can be potential donors. And in this country, that number cannot be ignored. We also have suicide victims. Their families can be counseled. Their organs can be retrieved and donated. The thing is, the staff on ground, the counselors who are talking to the family in the moment of grief, are not trained enough to talk to that family in that condition so that they would agree to donate the organs. It's a really tough decision for them to take at that moment. But if the family is thoroughly counseled, not immediately, but say after a day or two, and the body is stored properly until then, and the organs are retrieved after a day or two, that one family's decision can in fact save up to 4 to 5 lives. 4 to 5 organs can be safely retrieved and transplanted into another person. The major hindrance for organ donation in this country is the religious beliefs. And in rural areas, there are other myths around organ donation. That needs to be busted. The kids need to be trained because it's the family that needs to give consent to donate the organ. Until the family agrees, and there's a deep-rooted religious belief that you cannot donate an organ. What about the next life? These are certain religious conceptions that people have, and they are a major hindrance. So this proper training of staff on ground, especially those working in government hospitals. Government hospitals have a lot of brain dead patients compared to private hospitals. But if you look at the number of organ transplants that take place in private hospitals vis-a-vis the number of organ transplants that take place in government hospitals, it just cannot be compared. A, there is not enough staff to conduct these transplants. B, there is not enough people to tell the family that, okay, this is an option. This is something good that they can do. This way the person can continue to live through someone else. These are the two most important things that can go a long way in solving this problem, I feel.
Okay, Dr. Sudhir Kumar, I'll let you have the last word. What is the general myth that surrounds organ donation? The major reason why a majority of women in this country are organ donors and not men. The myth is organ donation will weaken you. If a part of your body is taken away, it will weaken you. Tell our viewers, does it really weaken your body if you donate an organ? And if there are any other myths that you hear about, any other grandmother's tales that you hear about that you would like to bust, I'll be most happy to hear them from you.
Yeah, absolutely right. So one of the commonest myths is that once somebody donates an organ, so they'll become weak or their health would suffer adversely. And the second thing is the risk of surgery, because retrieving an organ also requires a minor surgery. So they are the two myths. They feel that surgical complications would be there. But I would like to tell all the viewers that these surgeries are totally safe, number one, and they are done by trained and experienced surgeons who have good experience in conducting these surgeries. And second thing is there is no adverse effect on the health after donating an organ. So normally, let's say kidneys. So we have two kidneys. A single kidney can do as good function as our two kidneys. And in fact, there are some people who are born with single kidneys and they have absolutely normal life forever, like for the entire life, and they don't have any abnormal creatinine. Same way, part of the liver can be donated and the person would not suffer any effects on the health. So this is absolutely safe. So it is not correct to assume that after organ donation the person would become weaker. So everybody should come forward, and
Okay.
there should be no difference between men and women in terms of organ donation. And just to highlight about the cadaveric transplantation, so basically, in that because I'm a neurologist, and we have several patients who come with who are brain dead, who are potential organ donors. But at that point of time, because most of the accidents are sudden, it's a healthy young man mostly who's declared brain dead. So the family doesn't have enough time to absorb that sorrow and then agree for donation. So when we can have a drive when we can potentially sign for organ donation when we are hale and hearty. In an untoward event, if something were to happen, then our organs can be retrieved, and one brain dead person can save almost, we can say, 7 to 8 lives, because 2 kidneys, liver can be given to 2 people, then 2 lungs, one to each person, then 2 hearts. So many things. Cornea transplant can be done. So single person can, save so many lives. So it's a very noble cause. And then this discussion should happen in the mainstream, in the colleges, in the normal workplaces, and it should become like a drive
Okay.
where many people could sign up for donation.
I think that's what I hope our viewers are taking away from this show. I know many of you are thinking it's odd for us to be talking about organ donation at a time when pollution levels in Delhi have hit an all-time high. But ladies and gentlemen, this is about living after you have died. This is about saving 7 to 8 lives after you have died. So sign up for organ donation. You will end up saving not one, but as the good doctor says, at least 8 lives. Thank you very much, Dr. Sudhir Kumar, for joining us. I'm glad we had this conversation. Thank you very much to Dr. Vasanthi Ramesh as well for being with us. And thank you, Steffi, for joining us here on the show from Pune. Thank you very much, all three of you. I hope our viewers have taken away something from this conversation. Thank you very much. Let's shift